According to the World Journal of Emergency Medicine, approximately 1/3 of all emergency department visits are either inappropriate or non-emergent. Studies were conducted between the months of July and August 2011 on individuals presenting to an emergency room at a specific hospitals. Of those presenting to the ER, the complaints were divided in between emergent complaints and non-emergent complaints. The patients that presented with non-emergent complaints were asked a series of questions. They were able to determine that the patients that presented with non-emergency complaints had lack of access to primary care, low socioeconomic status, and lack of insurance. The effects of the overuse of the ED by non-emergent complaints were quality of care. It placed a strain on the emergency department staff and resources. Resources were diverted from the more critical patients to the patients with non-emergent complaints. Another effect of overuse of the ED by non-emergency complaint was that it was not as cost effective as a primary care visit. And the patient do not receive continuity of care by having an ED visit with no primary care. When I say continuity of care, I mean an ongoing medical relationship that exists between a provider and a patient, where their provider is able to manage ongoing medical conditions and prevent some of the ED visits by managing care at home. Studies also showed that even patients that didn't have insurance or had low socioeconomic status still had access to primary care. A lot of nonprofit health organizations have programs where patients who are either unemployed or have low income are able to apply for supplemental insurance, where they're able to see a primary care at that nonprofit organization, and they're able to see specialty physicians at that nonprofit healthcare organization. By patients taking advantage of the primary care centers available at nonprofit organizations, they can decrease wait times in the emergency department, decrease the overall money spent by the hospital on non-emergency complaints by individuals with no insurance, and improve the quality of care for patients that are more critical or that have emergent complaints. This will alleviate the stress off of staff and improve the quality of care while also decreasing the amount of money spent by the healthcare organization.